who do I need? Where do I need to go? What care do I need? Who's going to help me get that? My name is Anthony Dixon. I'm from Chatham, Ontario, but originally from Wales. I've been in Canada for 30 years now, and I've been very blessed by my opportunity to be here and stay and work within Canada. I am a family man. I have grown-up children who are doing very well. I have a partner who is very supportive of me, and she makes sure that I stay in line and on track and don't deviate from that. I am an emergency medicine physician. So I had a simple blood test, and there was an abnormality on the blood test related to my prostate specific antigen levels, or PSA is the kind of common term for that. It was abnormal. My family doctor, who's a friend of mine, called me to say there was a blood work abnormality. We should repeat this. It was still abnormal. From there, was referred to see a urologist, and saw a urologist who was another colleague of mine. Within essentially 2 weeks, was diagnosed with prostate cancer. Just 4 weeks after I was diagnosed, I had a what would be called a robotically assisted radical prostatectomy. Very few centers that do that surgical procedure. There's really only one or two in Ontario. I was matched to McMaster, which, I was familiar with from where I went to medical school. So I had some emotional support there. That there were many people in the hospital that were alone. In my own mind, I had been told that I had metastatic disease and that I was going to die from that. My oncologist in London, he wanted to see me because he wanted to start treatment as soon as possible. And I said to him, maybe I'm not the best patient. I said to him, I'm not coming to see you, I'm going to Australia because I'm never going to get there in my lifetime. However much time I have left. So I said, I'm going. I'll see you when I get back, and we'll figure things out from there. So while I was in Australia, I had a phone call from the oncologist, and he said, I'm not so happy with this test that you had before. I'm going to try and have it redone, and we're going to try and get it redone for you in Australia, because in Australia, this diagnostic test that you had is part of the standard of care, and you can access it. So we're going to try and get it for you while you're in Australia. So he made some phone calls, because the world of medicine is quite small. And I accessed through self-pay the same diagnostic test that I'd had before. And the test came back to say that not only did I not have metastatic cancer, but that there was no evidence of cancer. And the previous test was thought to be through false positive results. So I went from your cancer's back and it's spread all over your body, and in my own mind I'm dying, to you don't have any cancer. It was an unexpected road, and we celebrated that, but it didn't take away the fact that the blood work was still abnormal. There wasn't enough cancer in the body that had organized itself into a mass. I was very fortunate in that my urologist mentioned another option, and it was a medicine or a therapeutic treatment that's called LU177. So as a physician, that was probably the first time in my medical care that I actually had never heard that word or the name of this medicine. To me, it seems that it's the miracle of modern science that specifically targets prostate cancer cells in the body using radiation, and the radiation is delivered intravenously, almost like a Trojan horse to the cancer cells, and is delivered directly to them and is used to treat prostate cancer. It was a shock to me as he explained how this medicine worked. I think I even said to him, that's possible, we can do that in medicine. And that was the first I'd heard of it. And then through my oncologist, I spoke to him about that, and the kind of the journey started rolling really to what brings me here today, and to receiving therapeutic treatment with lutetium-177 at the Initio Clinic in Vancouver. Is not accessible. The current protocol is that you have to have failed radiation therapy, which I wasn't a candidate for. You have to have failed androgen deprivation therapy, which, given my age, I also wasn't a candidate for. You have to have failed chemotherapy, which it was something that I dreaded, both as a patient and having seen patients from a physician standpoint. And then maybe I was eligible for lutetium, a treatment that's proven to work. So essentially the setup currently is that I have to go through all those different treatments with devastating effects on the body, that essentially, because of the treatment, potentially have quite dramatic side effects, that I could become quite unwell from, and almost have to be at the end of my life to receive a therapeutic treatment that could save my life. It became a mission for me, in the sense that this treatment was the treatment for me. So I knew it was available, and I partially motivated, I think, by a little bit of anger that the system expected me to essentially die before it would give it to me. I started research. Where can I get this? How can I get this? Can I get this medicine and treatment that will essentially obliterate my cancer before it can take hold in Canada? If I can't get it in Canada, where can I get it in the world? Is it available to me, just as somebody that can call up and say, hey, I want this? The science behind the lutetium-177 is incredible. My motivation to do medicine was about kindness, and about respect, and about being treated as whole as you can possibly be treated. That was my experience with Initio from day one, from the moment the phone was first answered, to my questions that were probably not well formulated, to my emotions that were running high, as I tried to navigate the system. That has been my experience from the very first contact. That the respect that motivated me to do medicine was the respect that I received. And now I'm here.